Mackenzie, and I'm going to be showing you how to administer an enema today. Alright, so the first thing you're going to want to do is you're going to want to assess your patient. You're going to want to ask them about the recent bowel activity, the consistency of it, the duration, the color, the consistency. Next, you're going to want to ask them how they prefer to go to the bathroom. Obviously, if they're bedridden, they're going to be using a bedpan, but if they can get up and go to the bathroom physically or use a commode, that is most appropriate for their situation. So now what I'm going to do is I'm going to assemble my equipment. As you can see, I have it all laid out here. Now I'm going to get together my enema itself. So I'm going to take my enema bag and I'm going to fill it with 500 to 1,000 milliliters of lukewarm water. After that is done, I'm going to hang it on my IV pole and I'm going to prime my tubing without touching the tip. And basically all you're going to want to do is hold it over the trash can and you're going to unclamp it and just allow that solution to run through. After it's run through, reclamp and hook the tube up here for later use. Now I am going to wash my hands and put on clean gloves. After I got my gloves on, I'm just going to go ahead and go into the patient's room. I'm going to introduce myself and explain to them that what I'm going to be doing today, and then tell them how they can help me in completing their enema. So I am going to want to go ahead and provide privacy for the patient and help them into a Sims position, which is basically just laying on their left side with their right leg bent over. And today I'm going to be showing you how to complete an enema on this model. Okay, after they're on their side, you're going to want to cover them up with a bath blanket just to provide an extra layer of privacy and comfort for the patient. And you want to make sure the only thing that's showing is the buttock itself. So now what I'm going to want to do is retrieve my enema bag, and I'm going to, another thing that you're going to want to make sure is that you have a waterproof pad underneath of your patient to make sure that in case of this drips, it doesn't get all over the bed sheets and become a mess. So next, what I'm going to want to do is lubricate the tip of my enema. For this video, I'm going to be using soapy water, but normally you'll use the lubricant that comes with your enema kit. So you're just going to dip it in the soapy water. And now you're going to lift the right buttock and you are going to insert the tube about 7 to 10 centimeters or 3 to 4 inches. If when you're inserting the tube, if you're having a little trouble, you can be sure to tell the patient to take a nice deep breath and tell them what you're doing the whole time. But what you're going to want to do is unclamp and allow a little bit of fluid to run in just so it eases the tube going into the bowels. So now what you're going to want to do is take your bag and hold it at hip height, which is about 12 to 18 inches. And now you're going to want to unclamp and allow that solution to flow in. So while this is happening and you're holding it at hip height, you want to talk to your patient. You want to ask them, how are you feeling? Obviously we know it's uncomfortable, but are you having any additional abdominal cramping? Do you have a sensation of feeling full? And if their answer is yes, then you're going to want to lower the bag so the enema is running in a little slower. After you do that, if they are still experiencing the feeling of fullness or the cramping, you can even stop it and allow their bowels to just kind of adjust and relax for about 30 seconds to a minute, and then restart the enema, slowly moving your height back up. And another thing you can do too is you can actually, as the solution goes into the bowel, you can roll your bag down as to decrease the instance of the liquid spilling out. So once the solution is dispensed into the bowels, you're going to want to remove the tube. You're going to want to grab a paper towel, and you're going to just grasp the tube and pull out. Having the tube and the paper towel, you're just going to throw all of this away. Remove your gloves. Throw those away. Wash your hands. And now what you're going to want to do, you're going to request that your patient, or tell them, you're going to tell them that you want them to at least hold this enema in for 5 to 15 minutes. In this time, you're going to want to roll them back onto their backs. So it just, you just want to make it as comfortable for the patient as possible. Cover them back up. Do anything that they request, just again, make them as comfortable as they can possibly be, because we all know enemas aren't comfortable, and you want to make it pretty decent for the patient, or at least make them feel better. So after they have sat for 5 to at least 5 minutes, maybe to 15, you want to assist them to a commode or the bathroom, or if they need to, use the bedpan. If they're using a bedpan in bed, you want to set them up, because no one defecates while laying down. I mean, it's just not natural. And so after you do all that and your patient has defecated, you're going to want to document everything you've done. You want to look at the feces, just assess it for the color, the consistency, just all that good stuff, and then you document what you put into the bowels to stimulate, and then you're all done. Thank you.